For this week's digital study tool, I decided to do anemia, specifically iron deficiency anemia. The overview of what we're going to be talking about is what is anemia, who is most at risk, the symptoms, the diagnosis, and the treatment. First, what is anemia? Anemia is a reduction in the total number of erythrocytes in the circulating blood. This can be a major reduction of erythrocytes in the blood. It can be caused by a decrease in quality or quantity of hemoglobin, and it is a main alteration of anemia is reduced by the oxygen carrying capacity of the blood. Who is most at risk? Those that are most at risk are those with poor diet, intestinal disorders, chronic disorders, infections, women that are menstruating, or pregnant. The risk of anemia does increase with age. The symptoms of anemia are extreme fatigue, weakness, dizziness, short of breath, also associated with chest pain, pale skin, cold hands or feet, brittle nails, or inflammation of the tongue. The diagnosis of anemia can be ruled out by a series of blood tests to determine the blood cell counts. If the blood cell counts come back low, then the physician can order an endoscopy, which will rule out bleeding from a hernia or in the stomach. They can order a colonoscopy, which would rule out the bleeding of lower intestinal sources. Or for most women, they can order an ultrasound, which is used for women with very excessive bleeding. The treatments associated with anemia are oral supplements. If these oral supplements are ineffective, then an IV iron medication can be used, antibiotics and other medications. They can recommend a diet of iron-rich foods and vitamin C, or surgery to remove the major bleeding site. And here are my references. I hope you enjoyed.